So as Bruce has just mentioned earlier today, Health Minister Stephen Mandel and MLA Dr. Richard Starkey released the final report of the Rural Health Review Committee that had originally started its work in September of 2014. The report contains a number of recommendations, many of which we believe will apply to AHS, and we're going to begin work shortly on reviewing each of the recommendations to determine exactly what action we need to take and in what time frame we need to take it. But the provincial government noted today that there are two areas where actions are already underway at AHS. The first one is in further developing a provincial EMS service delivery model. And the second is in getting a stronger voice in local decision making and being able to push out to operating districts those decisions where it makes sense for us to do that. So while most of you are familiar with the changes to the EMS delivery model, the establishment of the 8 to 10 operational districts is in fact a new initiative for AHS. The objectives that we have in doing this, in making those changes, are to improve local input, as I said, into decisions that can be made at a more granular local level than what we've currently seen, into things like resource allocation at either the community site or program level, and looking at how we can streamline timely and effective decisions. We've heard from a number of people that we have built with AHS a bit of a cumbersome decision-making process in some areas, and that they believe that there's an opportunity for us to enhance their ability to be involved in and give us input into decisions at a more local level. We don't have a fully fleshed out plan for that as yet, other than to look at between 8 and 10 operational districts. We're going to ask each of those districts to come up with an advisory committee. So we'll talk about the process for committee selection and what the qualities would be that we're looking for. These will be advisory to the local sites and services within that district. They will be volunteers. So we are not looking at establishing boards or having paid board members. These will be volunteers who have a knowledge of the area where they live and want to have input into the decisions around health services in those areas. So the advisory committees will then have a direct reporting relationship with the designated leadership teams within those districts that will be accountable to a vice president dyad for the north and one for the south, who will sit at the executive leadership table and give us all advice then on some of the issues that we see emerging. They'll have an opportunity to talk about things like resource allocation. We plan to give responsibility for capital repair budgets back to the local operating districts so that they can make decisions on where to spend that money most effectively. We're going to keep, though, some centralized decision-making within AHS, so decisions around big new capital builds, a new hospital, a new family health center, whatever it might be, will still need to be coordinated centrally through Alberta Health Services. And we're also going to keep new technology, big new technology decisions will be made centrally as well. So we'll keep some control over that. And I used the example before of, we don't want to see a hospital make a decision to have robotic surgery if they don't have the supports in place for robotic surgery. And so we're going to need to coordinate that decision through AHS itself. We're also going to keep overall functions in finance and human resources and communications fairly centralized. So while we have unilaterally made the decision to move into these operating districts, we know that we're going to have to consult with people to see what the districts actually should look like, what the boundaries should be, how we can make them most effective, and how we can accomplish what we've heard from our communities, which is that they want to be more involved in giving us advice, giving us counsel, and having some local autonomy for the decisions being made. So we are going to go out over the next couple of weeks with a communications plan about how we're going to solicit input, both within AHS and external to AHS, and look to continue that process of consultation over April and May, be able to consolidate what we hear then in June and come up with the final approach for these operating districts and put them into effect by July 1. That's really all the formal remarks I had for now, and I'd be happy to take questions.